Hello, let me begin by reintroducing myself again. My name is Rispa. I am a Kenyan registered nurse, and I want to reintroduce the services that I'm offering at the comfort of your home. They include wood care, that is wood cleaning and dressing. We have patients who have chronic wounds, like the diabetic wounds. These are wounds that take time to heal. Other times they don't even heal, or pressure sores, or what we call bed sores. So instead, and I am emphasizing this because this is the care that is continuous for a very long period of time, and you find that the patients that have that are in need of this kind of care are the elderly patients that are not insured by any insurance cover. Every time they go for wood dressing at the facility, it is cost-wise, it is very expensive. So it is among the care that I'm giving at a cost-friendly price. So reach out if you are in need of it. Another service is nasogastric tube insertion. That is for patients who are unable to feed, and I'm focusing on the patients who are chronically ill, or patients that are elderly and they are not able to feed well. So there's a tube that we usually put through the nose to the stomach to help with feeding. So I am delivering this service at your comfort of your home to help in terms of nutritional support, so that you don't have to spend a lot of money in an hospital bed on this kind of feedings and nutritional supplementation. And also another care is what we call tracheostomy care. Tracheostomy is a stoma that is made on the trachea to help with breathing. So when someone has this stoma in situ or in place, they tend to block because of the secretions. So we are also offering tracheostomy care, which includes sanctioning and cleaning and dressing of the stoma sites. Another service I'll be offering is intravenous medication administration. I mentioned earlier in my early video that you do not have to be in an hospital bed for you to get intravenous medications. You'll find the patients that are not able to swallow, or maybe the bacterial infection rate is very high, that needs intravenous medications. And for that reason, you are admitted in an hospital to get this treatment. Again, it is cost saving because it is cheaper getting this service at your home, because you will not have to incur the cost of a bed, unlike when you are admitted in an hospital and other utility bills. The only cost you incur is the cost of medications and the service I'll be rendering to you. Another service that I'll be bringing to you is physiotherapy and occupational therapy for patients who have maybe suffered stroke or are in the recovery of particular surgery. So we'll be offering physiotherapy and occupational therapy. We have them. I have these practitioners on board. Another is psychological support. Anytime you're not feeling well, it comes with a psychological burden, not just to the patient but also to the relatives. So I'll be offering psychological support and psychological services to patients. Okay, so this is a bonus that comes along with this seeking the above other services. Then we'll have urinary catheterization and catheter care. Most of the times you find the elderly or the chronically ill patients have what we call bowel incontinence. Bowel incontinence means someone is not able to control their urine or their long calls. So for the urine, we put a catheter, a urethral catheter, and then it helps to improve the quality of life, because the catheter is connected to a bag, or you can spigot it, and when you walk, you can even be able to walk around, do your normal activities without worrying of the shame and the stigma that comes along with just having bowels moving or passing bowels unknowingly. Then we have chest and abdominal drains care. When we talk of drains, we have different types. We have the chest, we have the abdomen, we have the pericardial. So anytime you have an invasive in your body that is meant to remove some fluid accumulated in your body cavity, we have the pleural space, just right here. We have the pericardial space, we have the abdominal side. So most of the times you'll get to the hospital, have this drain spot, and instead of going back home, ideally you wait until the drain is less than 100 mils in 2 consecutive 24 hours period. What does that mean? 2 days consecutively, the drain has to be 100 mils and less, or less than 100 mils for it to be removed. Okay, so once you have this tube inserted for draining fluid in your body, you will not have to wait until it is less than 100. Why? We are going to be taking care of this drain for you at your home. This will reduce the expense of having to pay the hospital bed, the food in an hospital, and the rest. So we will be taking care of these drains at home, and then once they are ready for removal, we will be escorting you back to the hospital, or you will be going back to the hospital with our caregiver, so that you have the drain removed. Okay, so do not incur expenses when you're not supposed to, because these are long-term kind of treatment, and we really want to walk this journey with you. We want you to feel accepted. We want you to feel to experience the recovery process without undergoing too much of the strain. So again, if you've not you have, or rather you are in need of any of those, feel free to contact. My number is on the bio. There is also a brochure. When you look at my previous videos, there is a brochure that has my details. You can email me. My phone number is 0703975576 or 0762215729. You can also reach me through my email account, which is rizmmoredi@gmail.com. Let's walk the journey together. Let's improve the quality of life, and also let's mind about the finance implication when it comes to long-term care to any particular client. I've never have had a feeling of, or rather I'll say I have had an experience where a patient is in the hospital, not necessarily because they need to be in an hospital, but because the circumstances forces them to, where they are unable to settle the bills, and they end up selling their lands, their vehicles. So as we walk this journey, we are walking this journey together, putting in mind the people we are depending on, or the people that depend on us. So for the financial burden, we are going to sort you out on that. Thank you very much.